This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
It is still Croup season. Dr. Miller just discharged a Croup patient. Did anybody take care of that patient? Yes. What did we do for our Croup patient?
Racemic epi.
Racemic epi. Okay.
Dexamethasone
And Decadron and Motrin. Okay. Those are good treatments. Anything else you guys sometimes do for your Croup patients or recommend to the parents for Croup patients? Take them outside. Okay. I know. We always say that, right? Yeah, throw them in the snow. I'm adding that to my interventions. Okay, so just as a reminder, Croup is a viral respiratory illness that we see most commonly in the summer. Some studies say it's up to 5% of total pediatric visits to emergency departments, which seems like a lot. It primarily affects young kids, so kind of 6 months to 3 years old, although it can be older, all the way up to 10 years old. I myself have treated my very own son in room 9 in the middle of the night for Croup here when I was working overnights. So we do often tell parents to throw their children in the snow or otherwise expose them to cold. But it falls into the tradition handed down, sort of like putting mayonnaise on burns, right? Something that had never really been studied. So I love this study, which was in the Journal of Pediatrics in 2023. It was a single pediatric emergency department in Switzerland where the average temperature during the fall and winter seasons was less than 50 degrees. And so they took all of their Croup patients and they randomized them. So any child that presented with Croup during the appropriate season, if they had, there's a Wesley Croup score that they scored them on. If they had at least a score of 2, they got randomized. So on arrival, they got 0.6 milligrams per kilogram of Decadron, which is very similar to what we did. That's probably the same dose range that your patient got. And then they were randomized to either go outside or to stay inside. So the average temperature inside the ED was 70 something, like 77 degrees. That's a very warm emergency department. And then the average temperature outside had to be less than 50 degrees. And the kids were wrapped in warm blankets, taken with their parents, and they had to stay for at least 30 minutes outside of the ED. There was no specification about throwing them in the snow. And then they came back to the emergency department and they assessed them. So they were able to find 118 children to do this over the couple of years. There were more boys than girls. And how do you think they did? They did great. Kids who went outside did great. So they looked at a decreased score of greater than 2 on their Croup scoring scale. And for the 2 groups, the numbers were 49% for the outside group reduction in their Croup score and 23% for the indoor group. The interesting thing was these differences went away by about 60 minutes. So they felt that either by that time the steroids had time to kick in or it was just kind of a temporary effect of the cold air exposure. But this is pretty solid scientific evidence that we can make a difference by telling parents to take their kids outside in the cold. Probably has to be less than 50 degrees like in this study. So if you're looking to publish and become famous, I would say the next 2 things you can study are the steamy shower for little kids, because no one's studied that one, or the mayonnaise for burns. All right. So hopefully we won't have any Croup kids today, but if we do, we're prepared.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.